Aloha, everyone. Welcome.
Aloha.
Aloha, Sharon. Sharon is in the house. I just want to welcome Sharon, you, especially you, and everybody who showed up today for the live show, and all of you in the Facebook groups and on LinkedIn. Thank you so much for being here. We'll be dropping some incredible links into this episode, so please be sure to download the chat at the end. And also, if you have anything that you want to contribute or add, there'll be a time when we'll ask you guys can raise your hand, or you can stay after the show and speak directly with Sharon, because today is going to be another exceptional show here at A Dose of Positivity. We're going to be diving into releasing your pain, and we're talking primarily maybe about physical pain, but we're also looking at the emotional pain and trauma that comes with physical pain. What came first, the chicken or the egg? We have pain. All of us have some pain, whether it's heartache, emotional stress, or physical pain. So this show is for everyone. The replay will be up in a few days. And I want to honor that in the house I have TJ, who does all of the production of the show, and she'll be monitoring the chat. So, and as well as Shane. And these are very, very special women in my life. They came to me through Tell, who I'm just going to mention real quick at the beginning. We're going to pop in a link. We've been having an ongoing GoFundMe. She's literally fighting for her life. She's 36 years old with 3 children and has cancer, and Tell's worked with me and Soil to Soul team for 3 years. And she is a light and a love and has more courage than just about anybody I've ever met in my entire life. So if you can't send money, send prayers and love. Really appreciate y'all just at least opening the GoFundMe and look at her story, so you can not experience her pain, but help ease her pain. And that is amazing, how the human connection, the human body, mind, and spirit, and energetically, the power that we all have. And that is something Sharon's going to bring here today. So thank you all for taking the time and sending love. Tell we love you. And Shane happens to be her sister-in-law, and TJ is her cousin. And they work to make Soul to Soul happen. Thank you, girls, for being here today. So before we get started, because a lot of people are still coming into the room, I want to introduce myself to all the new people. My name is Donna Maltz, known to many as Mama Donna. And we'll pop in the link to donnamaltz.com so you can geek out, and also you'll be able to see all the other episodes. This is like our 92nd episode of incredible healers, of the planetary healers of both body, mind, and spirit, that I have the great honor and privilege to bring onto the show. So I'm also an author and a nature photographer. And if you pop in your email, our team puts out a daily dose of positivity every day. We put out a beautiful nature photography, a photo that I do, and then quotes either from myself or other amazing spiritual and transcendentalist healers, of planetary healers. Very uplifting. Some days it's like a fortune cookie. You either open it or you don't. Some days it speaks to you and you go, wow. It's really helping a lot of people get through these challenging times. So yeah, just pop your email in there and we'll stay in touch, and that'll be lovely. So this is from my book, one of my books called Conscious Cures, Solutions to 21st Century Pandemics. And I wrote this book during the height of COVID. And in the back, I did 33 cures in the back of the book. And body work, obviously, is one of them. But yeah, and then we'll jump right into the show. Okay, so thanks to just a short paragraph, and I start with a quote from Mark Twain, and this is from the chapter called Conscious Cures, Soul, SOUL, Solutions Full of Possibilities. The secret of getting ahead is getting started. The secret of getting started is breaking your complex, overwhelming tasks into small, manageable tasks and starting on the first one. Now, this quote means so much, thank you, Mark Twain, to me when I'm thinking about Sharon, because when she works on me and has worked on me over the years, it's all like about these tiny little muscles, you know, the things that you don't think. And we all got to start somewhere to release our pain. So here's just a paragraph also from the book. It says, each of us has multiple and tangible ways we can support our well-being. When we feel good, we can help others navigate a better, novel way of being. Together, we can help heal the earth. Our physical and mental health strengthens when we focus on positive and incorporate daily practices, which Sharon's going to show us, and healthy rituals. We can all get through this challenging era by fortifying ourselves for what is yet to come. A healthy mindset, a robust immune system, and letting go of fear and judgment is a recipe for success to defend ourselves against any daunting crisis the world is facing. And we'll put a link to all the books and everything so you can read more if you're interested. And just so you know, all my profits from my books and photography go to right now to supporting TEL and other environmental causes. So I'm no shame in asking people to support and purchase these beautiful things. So Sharon, I want to thank you for being here, and I want to let everybody know her bio is short and brief and very, very perfectly. This is a great bio, Sharon. Thank you for providing us with it.
Oh, you're welcome.
Sharon it is about trigger points and how to release them over the past 40 years. Following graduating from Bonnie Prudence School, she was fortunate to intern with founders of the field of Myofascial Trigger Point Therapy, including Dr. Janet Trevel, the first woman, love that, to serve as a physician to President under John F. Kennedy. Sharon co-authored a book on low back pain, which has been translated into Japanese and Korean. And she has treated chronic pain patients from as far afield as Australia and the Sicilia Islands. She has treated professional football players, musicians, physicians, and those suffering from fibromyalgia. As so many of us have become a workforce obligated to interact with the world through computer screens, excessive sitting has become one of the leading causes of chronic pain. Effective treatment of chronic pain and dysfunction can be much improved by self-care routines, including a range of motion exercise, stretching, and self-treatment using simple tools. According to Sharon, offers instruction to both hands-on practitioners and patients. So she works with, she's a teacher and a physician. Sharon travels between Chicago, Hawaii, and Utah, where she treats all her patients, and she has taught hundreds of students and patients in Chicago, Nashville, and Hawaii. And she is returning to Hawaii. For all you Hawaii people, she'll be here later this month, and she'll be leading classes on treatment of the lower back pain, elbows, and hands and arms. So they'll begin on April 27th. We'll have the link in here, so no need to worry about it. We'll have the link to that for you. That's why I want to make sure you guys all know how to download the chat. So I just want to say that, Sharon, it is an honor and a pleasure to have you here. And everybody, welcome to the show. So Sharon, hi.
Yes.
Sharon is accompanied by Paul. He's going to be working the camera. And if anybody...
yes, thank you, Paul.
Yeah, thank you, Paul. If you guys have any having difficulty hearing or seeing things, drop things in the chat because we don't want you to miss anything. So Sharon, thank you for giving us a little Mark Twain advice and getting into those little details that we can all do every day. And tell us, I have so many questions for you, but I do want to start with looking at this hour, the short, brief time that we have with people, and in making sure that we're incorporating triggers like what happens. I know when you work on me, especially, you trigger a lot of emotions, a lot of tears, and it's not just from physical pain, but there's also emotional pain. So I want to make sure we cover that. And I also want to have you talk about very important, when is it time for surgery and when is it time to do what you're teaching us here today. So because in full disclosure, you know, you guys, we don't want you to go out and if you have chronic pain, things that are happening, we want to make sure that you're getting advice from your medical practitioners, Sharon, who is a complete professional, and I swear by her word more than my orthopedic guy. But I want you guys all to, I want Sharon, you to really cover that to protect yourself and everybody on the show. So why don't you, before you go in and sharing some exercises, let's talk about how did you come up with this whole amazing program that you do, that you teach and do for people? How did that come to be?
Well, I started out with having some pain problems in my early 30s and 20s. And so I was traveling through Massachusetts, and up on the screen was Bonnie Pruden, my teacher, and she was pressing into someone's gluteus maximus with her elbow. I thought, that's what I need. So I found a myofascial trigger point therapist. She treated me once and it fixed everything. So I thought, oh, probably it'll come back. I better learn this. So then I started school about a week later, and the school had already started, and I quit everything I was doing and went to go to the school. So that's how I learned. And I wanted to get really pain-free and fully functional, and have a pain-free life. That's what I was looking for. And so I've been doing now since the 1980s until now. And
what were you doing before?
Those of you that have a ball with you, you could use the ball while you're listening, and you could just go ahead and go around your pecs and your chest and treat yourself, so you're not getting all dysfunctional while you're listening.
While we're sitting here, tell us, what were you doing before this that created that pain in your body?
Oh yes, what was it that caused it? I think afterwards, I began to think that it was. Okay. So there's different things. I think I did notice that even when we got rid of it took about 4 months of going to school, and I didn't have any headaches or anything after that, and so I was like excited about that. But then I was about a year into school, and I was trying to do. I was the only artist out of the whole school, but I was mad because I couldn't draw the muscles exactly the way I wanted to, and I started to get really tight and I couldn't draw at all. I just couldn't draw. So I just thought, oh, release and relax, release, and then I couldn't. Every single stroke was perfect. I couldn't even draw in a way that it was like the difference between. So I realized that all the tension that had built up in my body up to that point was actually, was stopping me from being creative, and was stopping me from being pain-free and things like that. So I could see that a lot of the way I was thinking was creating the tension in my body. But this was taking it away. But, maybe don't put it in, right? Don't put the tension in. You don't have to take it out.
Right.
So
how do you do that?
Oh, okay. So one thing you'd like to do is actually just you could treat the whole body, maybe every day. Just look around for painful areas. So I like to do it. So you could do it on the wall. You can get it like this. You put the ball on the wall, then you look for a painful area, and then you press in. So what you're really trying to do is find the painful areas, and the painful areas are filled with painful chemicals. Prostaglandin, tumor necrosis, alpha, substance P, interleukin 1 and 6. And when you press in, you're squishing those out. And when you lift up, that's the most important part, is the lifting up. When you lift up, the blood supply goes into that area. So what I'm doing everywhere is putting blood supply into the muscle so that it works, so that you can contract it and stretch it. So that's what we're doing. Pressing out the painful chemicals that are there. So you're looking for the painful areas to press into. And then when you press in, and lift up, then you're letting the blood supply in. So that's what I'm doing all over the body.
How does trigger therapy then differ from, say, massage therapy or from acupressure, acupuncture? What makes
So
this?
I'm using not acupuncture, but I'm using acupressure massage techniques all the time. But I'm also using compression, which sometimes massage therapists use. But so compression is you look, so if a muscle comes down here to your finger and comes up here, and the trigger point is right here, that's usually where the trigger point is for this muscle.
For
you
which
would press
muscle?
on it. Say that again.
What trigger point? Wait, just tell me, which muscle is that for?
Oh, the muscle that goes into this finger.
Okay.
One of the extensors, yeah, right here.
What
And
about the
this
middle
muscle,
finger?
the index finger. If you look over here, you'll see that if that finger is hurting, you can see that it will have pain, but the pain comes from all the way up here. So let's look up here. Yeah, nice. So that's where I was, and that causes pain in these fingers.
Okay.
So if you have pain in the finger and it doesn't go away, we could look for a trigger point. So a trigger point would be a tight spot in the muscle that causes the referred pain. And so I created this nice chart here. So here it's all in words, but no, if you're hurting in your gluteus maximus, these are all the muscles that cause that pain. So you go in and you could use massage techniques, you could use acupressure techniques, you could use different kinds of techniques, you could use compression, and you're going to press in. The main thing is you're trying to get the blood into the tissue, into the fascia, and into the muscles. And so,
nice.
So myofascial trigger point therapists know where the pain problems are, where the trigger points are, and then they apply those techniques. You can apply those techniques to the muscle so that you can get rid of the referred pain to the finger. So even like, say, for instance, if a limb is cut off, a lot of times you still feel pain in your hand because some of the pain is from muscles in your neck and shoulders. And so it's sort of like phantom pain, so it's like pain that you're experiencing. And so that's one of the areas that a lot of times if you just go, the likelihood of the spot that hurts. So say, for instance, if your hand is hurting, it'd be 80% likely that it's from up here, the shoulder, neck, and hand and arm. 80% likely. It's only about 20% likely it's from the hand itself. So, if you treat, it's like a priority of treating the muscles that are actually causing the trouble.
All right. I want to ask you a question. I also want to invite everybody, if you have a question. Okay, so I have trigger finger, and I think I know like probably 10 other people have trigger finger, and some have gone and had like surgery for the tendon. So are you saying like if you're working this, we can cure the trigger finger?
Yes.
Without having surgery?
I would say trigger finger is always fixable by doing hands-on treatments. Yes, or using tools on yourself on the wall. So trigger finger is, again, so these muscles. So which finger should we think about?
Mine's the middle finger mostly.
Okay, if it's the middle finger, so then this is the muscle.
Yeah.
So the muscles come from the finger and all the way up here and to here. And then there's also muscles on the other side that come this way and come to there. So you're looking for a muscle here that affects the finger there. So here. So if you have a trigger point in it, when you go over it like this, the finger moves like that. So I'm just doing it on purpose, but I'm just saying,
Yeah.
if you have a trigger point in it, it makes the muscle move. When you go over it here, then you know, also you can feel it's tight. You know, you feel, oh, you can feel that muscle moving. Then you can, on the other side, you can feel it too. And then then we could go and we could treat it. So let's see some good ways of treating it. So I have a couple of tools and stuff that we could use. So especially it's good to use heat. So maybe come on over here. So you might have these hot water bottles. So before you treat something, you might put your hand in the hot water bottle and heat it up. But you know, in Hawaii, you don't need it as much as you do in Chicago. But you might run it, yeah. So also when you're treating through the hot water bottle, it doesn't hurt as much either. So that's a good thing. Okay, so here you might take about a few minutes and warm it up, or even just have it, and then you could start treating it. So one way to treat it is you could use your other elbow like this. That'd be a good way. Let's see, did I put that?
This is so good. Yeah.
Oh, here it is. And so I have some little tools to use. So one thing we could do is we could use little tools and come up here. So we're looking, so here's, so we can, if we resist this finger, you can feel the muscle moving here. So you know which muscle it is. So I can feel it right there moving. Can everybody try this?
Yeah,
Can
let's
they
definitely try this.
put their finger, move their finger and see if they can feel it moving? That's one of the trigger finger muscles.
Okay.
Then we could press on it with our tool, like this.
Yeah.
So you could be like a wooden spoon. So this could be the end of a wooden spoon, and you could use that to press onto it. So if you have a wooden spoon at home, you could press on it this way, just like that.
What about your fingers? I'm just using my fingers.
Well, I love using my fingers. So if I was using my fingers, I might come, so I feel it right here. I might bring it close to me like this and press on it like that. And if you bend it at the same time, then you're stretching it while you're pressing on it, which is good. So you're coming like this and you're squishing the painful chemicals out. You're looking for painful spots. So tell me, can they find a painful spot right here?
Yeah.
So if you bend it like this, you're stretching it while you're pressing on it, and that makes it a little bit longer. And then you're going to come all the way down, all the way down. Oh, this is something we're doing in the class on the 8th of June and on the 1st of June. We're learning how to get rid of elbow form hand pain at my classes that we're having. You could come all the way down and press all the way down. So here, all the way down to
Oof.
Down to here.
I can't even bend.
Then you could go to the other.
Oof.
So we could pin it like this. So we're stretching it while we're stretched. So just stretching that finger. Then we could come on this side. And if you push, you can feel where it is. Yeah, there, I can feel it right here. So now we're going to press right here. Breathing and relaxing. So breathing. Inhale.
How can you relax?
Hold. Exhale. Yeah, you're looking for the painful spots. The reason is because we found that in the trigger points and in the muscles that are tight, they're filled with painful chemicals that the body puts there to hold it there to help you. So you're just showing the body, I don't need that help anymore. I don't need that muscle to be so tight. So we're pressing in, squishing out the painful chemicals. Now I'm mostly working on the tendon. Now the muscle is way up here, but the tendon keeps coming down. So I make it a little longer and treat the tendon. We could use a nice tool or a wooden spoon, and we could come all the way down. And then also it's good to treat the whole finger. So it'd be good to, and I like to hold the hand kind of close to me and squeeze it from top to bottom like this. Breathing and relaxing. squeezing top to bottom. Now, I've been using my hands a lot for the last 40 years and every day. And so I prioritize my hands, and I make sure that I keep them in good function all the time. So I wouldn't tolerate having a trigger finger, because I would just get right after it. It would not happen. Well, if it happened, I get rid of it.
Wow. That is so Sharon.
What do you want to do? Make sure that your fingers. Say again.
I was just going to say, like, how this is kind of, it's painful. Like, how often would someone need to do this and to make the trigger finger go away?
Okay, I would say probably 2 months working on it, maybe every day. But it might go away a lot faster than that. But I mean, if it's a chronic problem, probably 2 months. If it's something, what if it just happened today? It might go away today.
Okay.
So chronic things can take up to 2 months of treating it every day. But something acute that just happened, you can get this go away like it's never been there. So something that just happened today, you can often get rid of it today.
That's great.
So the other way I would treat it, I do it right on the wall. So I take the ball and I put it on the wall. And I put it right there. So let's see if we like this spot. So the same spots, so the same muscle right here. So another way of doing it is doing it with the ball. So you put the ball there, have your body, and you press your body onto the ball. And it's easier because you don't have to press in with your hands, So you keep taking it down like that. What do you think of that, Donna?
I like that. Yeah. I used
to do that, right?
Yeah.
But it's nice to be able to do it both ways. So then you keep coming down like that. And then another way of treating it is doing the other side. And to get that done, you go ahead and you put the ball on this side.
Is that a tennis ball?
This is a cork ball. Ball made out of cork. But it's about the size of a tennis ball.
Can you use a tennis ball?
Yeah, tennis balls, perfect. But I like cork a hair better.
Okay.
So like tennis ball's good. So I put it like right here, see, right there. Then I put my body weight onto it and let my body do it. It's like somebody else is doing it. You see? So you go in here, you press your body onto it, and then you breathe and relax. And remember, when you lift up, that's when the blood supply goes in. So you could hold it for 2 breaths or longer, but the main thing is you want to lift up so that you can get your blood supply into it. And you keep coming down, and then you come down all the way into the palm. And then you can have your butt treat your hand. See?
Yeah.
Butt's doing
it. Nice butt work, Sharon.
Butt work. Now I've got the ischial tuberosity treating my finger.
Yeah.
So this is a good tool.
That's a good tool. What about, like, I do this a lot. I push really hard. Does this work? Like when you're, can you see that? I know you're.
Well, that's good. I like that. So range of motion exercises would be, this is a good exercise, and then you go this way and this way, but you especially want to do things for the middle finger. So you could especially go this way and that way because it's the middle finger, but then you've got to do also this. You've got to bend it all the way and come this way. You have to stretch it this way. So pin it and stretch it that way.
All right.
So this is its range of motion exercises. But it could be important. It'd be nice maybe to do for the whole forearm. Go this way.
Yeah.
And then that way.
Yeah.
This way, like that. And
I hope
then
everybody's doing this. This feels really good, you guys.
This is the triceps, so here the triceps comes down all the way into the hand too. So it's nice to do the triceps. And stretch the biceps, stretch the triceps, stretch the biceps. And then the neck, it'd be nice to take your ear to your shoulder and stretch the side of your neck, and come and stretch the side of your neck. So the scalenes could come down and bother your hand as well, the side of your neck. So let's take a look. I have a new book that I'm about to I've been creating for the last 2 months.
Great.
And I somebody in Hawaii told me, why don't I do this? And then I did it. So
Good
I've got
for
it with me.
While she's getting her book, you guys, I really hope you're all taking advantage of this time and doing these exercises. You're off camera. That just helped me so much. Don't be shy. I'm even on camera talking about this and doing this. And the thing that I find is it's kind of like that, going back to that Mark Twain quote, is it's just these little things that we do every day. We don't have to do this monstrous thing. And like Sharon, you said earlier, like we're all at the computers, all of our hands need love. And
They do. They really do.
and then the fact that it's coming here from our neck, a lot of this, more and more people are getting trigger finger issues with their hands, and they don't even realize it. It's because it's the 21st century disease that's happening. It's this addiction to electronics and
Right.
being bent over.
Right.
And so trigger finger is becoming, well, this word on a trigger class. Very,
Well,
if you don't have it yet, you probably will. So this is good, Sharon.
So we're having a class again at CrossFit's All-Star on the 8th and the 1st of June.
Is that in Chicago or in Hawaii?
No, Hawaii.
Oh, good.
It's
Well, we'll put all that
in
in
Waimea.
here.
In Waimea.
Fantastic.
So what if you're having trouble with your fingers? Okay, so then you would look here, and that's it. I can't. It's either 59 or 60. Can you read?
Yeah.
59. Okay, so then you go into the book to 59. So it'd be in the end of the book. Here it is.
This
And
is
these
the
are
new
all
book?
this is my new book.
Oh, this is fabulous.
You just go to where it hurts. And so there it is in the fingers. It's pointing at it. And these are all the muscles you want to look at. So you want to look at these muscles in the hands, these muscles in the hands and the side of the chest, these ones in the forearm. And so this would be for finger pain, finger pain and dysfunction. And then the next page has how you do it yourself.
This is fantastic, Sharon.
Isn't it great?
You're going to have to let us know when the book's done and where we can. I definitely want a signed copy of this. This is really fantastic.
So anything you're looking for,
Mm-hmm.
you just look where it hurts, and then it says it in words, and then you go back here and it says it all in pictures.
Fantastic.
So
Yeah. Is it when is this going to be ready?
well, I've got somebody in the Philippines helping me finish it up. So, you have to communicate over, how that is. So I'm working on it, but I would think I might have some preliminary copies that I might make up right away that aren't perfect.
Yeah.
But I might start self-printing them,
Yeah.
And I was going to get somebody to the people who published me before, New Harbinger. I was going to show them the book pretty soon, and I was going to see if they wanted to print it for me. Yeah.
Yeah. Well, that is a tool onto itself, and I love how
I couldn't believe it.
I love how you brought us through the exercises, and then you showed us in the book. There it is, everything that you just shared. If anybody has a particular body part that's bothering you right now, put it in the chat, and we'll look at the chat. I'll look at the chat real soon, and then I'll let Sharon know, and we can work on that next area. But while I'm waiting to get any feedback from anybody, and also TJ, check the Facebook Live and the LinkedIn Live and see if anybody's commenting for a body part. While you guys are coming off or being shy, you don't even have to come off, just put it in the chat if it's your lower lumbar, your toes, your, anything, your shoulder, scapula. But Sharon, let's talk about real quick. You just said it would take, say, someone who's had chronic problems with trigger finger, doing this daily for about 2 months. And so,
right. What
are the chances? I mean, you think it's 100% that this can work? I mean, we'll put all the surgeons out of business, or is there a
I think it's
time when?
100%. I do think it's
Yeah.
100% that you can fix it because it's a muscular problem. It's a soft tissue and muscular problem. So if it's a soft tissue and muscular problem, well, maybe there could be a time when it's some other kind of, maybe a bone's doing something or something different. But I just meant mostly it's a muscle dysfunction.
Yeah.
And it's only one finger, so it's not like it's it's not systemic. It's just one finger. So it's so I would say the likelihood of being able to fix it is very high, using hands-on techniques. But maybe it'd be good for you to learn more than I just showed you. Like, say, for instance, maybe it'd be nice to videotape me just doing that particular thing on you, and then you could have the tape and you could follow the tape, from your telephone.
Yeah. And then squeezing balls. This is what I do a lot. I squeeze I squeeze balls, like squeezing
Yes.
ball. Is that a good thing to do? It feels good.
I think it's good, but you're so basically what you'd be doing is you're strengthening these muscles here.
Okay.
But that's not going to lengthen this muscle, and it's not going to lengthen this one. But I like strengthening. I think we should do strengthening for everything, Just if strengthening is not working because you've got a pain problem, then we should fix it. But I think strengthening is terrific. But the Chicago Bears football team,
yes,
was doing strengthening for 3 years, and almost all the players had excruciating inside of the elbow pain. And they did arthroscopy, they did surgeries, they did everything. Nothing fixed it. Because why? They weren't treating the muscles that were causing the pain. So their pain. So we wanted to figure it out. So they came to me because they saw my poster on a massage therapist wall. So they all had this pain 50. Is this 51?
Yeah,
51. Okay. So then I just went to 51. Here's 55, 48. Here we go. Okay, here 50, 51. And guess what the pain they had? So it was from the pecs. So probably they were doing a lot of pec strengthening, so probably, so that spot there was referring to their elbow, and these muscles here on the side of their chest were referring to their elbow, but especially this one, it was underneath all the other muscles, and they never treated there ever. And that was really causing it bad. So this is the posterior superior serratus, is underneath your rhomboids and underneath your trapezius. And that was causing a wicked elbow pain right here. Wow. So you could treat, if you're a massage therapist, or a doctor, you're probably treating the area that hurts. But the area that hurt didn't have anything to do with what was their pain. Yeah. Nothing.
Yeah. So
nothing at all.
Listen, I have a couple people wanting to go on to low back pain, but before we jump into low back, what happens to these players, the Chicago Bears? They had surgery and all this stuff,
right?
And then you have to go backwards and do this trigger therapy that you're
doing. That's right.
So do you?
They had operations. They had cortisone shots, but they were doing it. They never did it. What if the doctors had this book, okay? Yeah. And they did the injections right where the X's were. They would have fixed it. So, but they don't know that these muscles are causing it. That's the trouble.
Right.
Yeah. So you could probably use other techniques. You could probably use acupressure, but you have to use acupressure on these muscles. You could probably use acupuncture, but you'd have to. Well, acupuncture could also be used right on these muscles, and they could have done injections of pain relievers. Or usually we never use cortisone because cortisone makes the tissue dysfunctional, but we would use saline with a pain killer, like you would use like a dentist would use on your teeth, if they're going to do dental work, and you would just go right into the X's with the pain relieving juice. Wow. Then you want to massage the muscles or do compression on the muscles, and then you want to move them. So then you have to move them. So then for or here, so that's why I put in here all the movements. So I put in, different movements for you to do after you do the trigger point injections, or after you do acupressure, or after you use acupressure needles into those muscles.
Yeah.
So that would be all. There's lots of different ways to do it. Yeah. But the thing is, if you do, they did laparoscopy. They couldn't figure out why. They couldn't figure out why they couldn't get rid of their pain.
So now you worked on these athletes, and what happened?
They got it. They're in terrific shape. Every one of them came in. It was gone in 20 minutes.
Yeah.
I did a longer evaluation. I did like an hour evaluation. I wanted to make sure I was covering everything, because they're top athletes. And so, but then the treatment, it was gone 20 minutes and never came back. And the reason is I trained them how to fix it. Yeah. And they were very good at doing their self-care. And so then after I fixed one thing, they said, well, can you fix this? And then I showed them how to do it. So they were very easy to fix, but you can imagine if they get, they're probably good at healing. They're good at that kind of thing, because they're a top athlete. Yeah. Well,
listen, this is so great and very encouraging. And believe it or not, we only have like 20 minutes left of the show. And I would love for you to, I would love for you to jump into lower back pain. And also, I know this for sure, that because I've had lower back pain for most of my life. And I've been told that there's a lot of emotions, trauma and emotions hold in different places of your body. So while you're talking about this, I'd like you to cover some of the emotional aspects of, what triggers things and how we hold tension and stress, and how our emotions maybe hold us back from healing.
Well, I have been aware that sometimes people just tighten up these muscles. They have their reasons, but these are all the muscles that cause low back pain. The psoas, the abdominals, and the glute muscles. These all cause low back pain, as well as these muscles along the spine all cause low back pain. And these would be the stretches that you would do. Oh, right here. I have more stretches, but I guess I didn't have them in this little group.
What if it's too painful to do the stretches, and it makes it worse?
Good point. Okay, I love this. So what I like to do is treat the muscles first, but lightly. Very lightly, or do it in hot water. Like get into the bath, like a hot tub or a bathtub, and treat right in the bathtub, or take a bath and then do it when you get out of the tub, so you're nice and warm, and so it doesn't hurt so much, and you don't always have to put so much pressure on. You could work lightly, but then you work a little bit deeper, a little bit deeper, a little bit deeper over time. So how do we? So in my book, let's go to a couple of different kinds of back pain. Okay, so let's look at 16. Let's look at 20. So here we have sacroiliac pain. So this would be pain right here, right. So this could be considered back pain right here.
Okay.
But it's lower, really low. And that would be like sacroiliac pain. So it's where the sacrum and the ilium meets right there. And so one of the muscles that causes it is in your lower leg. Really? This one right here. Yeah. So I was going to show us all how to treat that. So that's one of the things that help with lower back.
You're kidding.
Not kidding.
Yeah. Yeah. Wow. Okay. Yeah, because a lot of people with lower back,
especially if it's.
Oh, go ahead.
What was that?
I was going to say, so many people I know who are having lower back issues are feeling it so much in the hip and in the groin, and they think they might need a hip replacement, like me. I thought I did. So meaning if you work your calf muscle down there, it's going to relieve that tension in your hip.
That's right. So say for instance, let's, I'm gonna show you how I would, some ways I'd like to treat it. So how about when I come to Hawaii, I just was on the airplane, and then I go over to uh, one of my friends' houses that has a hot, and start treating myself just like this and get right into the lower leg. So one way of getting rid of low back pain after you sat for 15 hours in the airplane is you could treat your lower leg.
Wow.
And so what I do is, this is one tool, but there's lots of tools, but I like this tool.
I have one of these.
And so what I do is I press in and then I stretch, and then I press in and stretch, and then I press in and stretch, and I see if I can get really good. And so I can feel. So this is, so especially if you could look on the other side, Paul, the ones that go up to your low back are on the outside of the back of the leg. Okay, so it's in the soleus, but over here on the outside. The inside, what if you had heel pain? Then you would go this way and treat on the inside, and that would go down to your heel. So what I'm doing is pressing out the painful chemicals, and I'm letting the blood supply in, and I'm folding and stretching. And I like to do this especially right after I get to Hawaii.
Yeah.
So that I can get the airplane out of my body.
I love that.
All that.
So you're saying it's the outside
stretching.
of the outside of the calf will work on the lower back. Now, do you want to do that on the same leg that you're feeling the pain? Or
That's
the
right. The same leg, the same side, the same leg. This side would cause pain right here in the sacroiliac joint. Okay. But then you could also come up and treat the sacroiliac joint. So one of the things we want to treat is the hamstring. So if we treated the lower leg, now we could come up here and treat the hamstring, and come up here and then really stretch it, press in, stretch it, press in, just like this. So this is important. But one thing that I found was really important that everyone should know is that I like to look at the nerve that goes to the muscle. Like, what's the nerve that goes to the soleus muscle? So that, and then I like to go and treat the nerve root to that muscle. So how would you know which one was the right one to treat? So let's go over here for a second. So on my poster, so if you go to number 20, and then you come over to 20. I have to put my glasses on. So you see twice.
Listen, okay, while you're doing that, can I just say something that I think is really important for everybody to hear? What I have always learned is that the calf muscle are like your second heart. And it
That's
helps.
right, the part we were just treating. Yes.
Right, exactly. And so one of the things that I suggest people do who are having lower back problems or heart issues is every morning I try and flex my feet before I even get out of bed 100 times.
Good.
Back and forth, pumping oxygen into the calf muscles. And so this is just making so much sense because I definitely feel it in my lower back. It helps me get out of bed in the morning so that's an easy thing we can do.
So you already figured that out.
Yeah, I figured that
you
out.
Already were figuring that out.
You confirmed it. It's so good.
So that was the last one on the list, was the soleus muscle, the lower leg right there, but it's L5 to S2. So let's treat the nerve that goes to the soleus. I put that right on the poster, and that's going to be in my book. So I'm going to show you how to treat that nerve. So here we go.
Brian, we got to get you back out in the yard, so this is good.
So you're going to take the tool, and you're going to put it underneath you, and you're going to find. So how do you know where L5 is? It's at the bottom of the spine, just before you come to the hip. And then you can put the tool right there and press there, and you can decompress the nerve.
Yeah.
We're going over this on the 27th of April, at the same location at the CrossFit
Waimea.
All-Star.
CrossFit. Okay.
And also, I'm giving a free workshop on this on the 30th at Tutu's house.
All right.
There's a free workshop, and I'll have all the tools. Everybody could try the tools, and I'll have them at Tutu's house in Waimea.
Okay, half these people most of these people on live are not.
They're not in Waimea.
They're not in Hawaii, but that's okay. I am, so that's good. Yeah, that's very good. Oh, this feels good, Sharon. This has just been so helpful. Really, really good. You
So
guys,
yeah. And then you could treat the whole spine with this if you want to, and that could be really effective.
Mm-hmm.
Also, the most likely muscle to cause low back pain is the psoas, which is right here. So it starts. You find your belly button. You come just to the side of it and press in there. You come all the way down to your leg. It's the muscle you use for lifting your leg, right here. So how do you treat that one?
Oh my God, yeah.
So Dawn, you have this ball, right?
Yeah.
So what you do is you can put the ball right where the muscle attaches right here.
Yeah.
And you can use it right on your desk like that.
Mm.
That's a good way to do it. And then you could come up higher, and then you could press in like that. And then you could come up higher, and then press in, and then you could get your body weight onto it like this. And then keep coming up higher and get your body weight onto it like that. And so what I find is when you release the tissue, a lot of times the way that it got tight or the way that it was injured fleets across your mind. So you're apparently those things that happen to you get stuck in the muscles. And then when you're treating them, a lot of times you might think about you often as you're letting go of it, you remember how you put it in. You remember the time you fell or the operation or whatever happened that created the problem. Yeah. Okay, so then after we press on these things, after we press on the muscle, then we like to stretch it. So for this one, you go like this, you stretch it, and then also it's good to bring it up and contract it all the way. And then you go back and you stretch it all the way. Then you come up and you shorten it. So and then also you could turn it in, turn it out, turn it in. So the muscle does a lot of different jobs. So one of its jobs is helping to turn it in and out. So
that's a nice dance move there, Sharon.
Yes, you got to dance.
Yeah.
Now, one thing that causes really a lot of hip pain is these muscles right here in the waist. So that would be causing pain all over the hip through here, and it's here in the waist right here. So I like sometimes to walk around and just press on it like that, but that doesn't push in very hard. So it's kind of a little better to do it. Which maybe here. So I'll put it right here, but then you could stretch at the same time that you're pressing on it. Like that. Press on it at the same time. And then afterwards you can lean to one side, lean to this side, lean straight up, lean.
Yeah. Oh, man.
So good.
So good.
Okay, another muscle you want to treat is the abdominal. Okay, so the abdominals, for that, I might do it on the wall. So here, use the good places. So if you're thinking about sacroiliac pain right here, then you want to treat low. So here you come this way, you find the pubic bone, and you're treating right there on the pubic bone right there, and you look for a painful spot. Then you're going to breathe and relax, and you're going to come up the whole abdominals, looking for painful spots and pressing right onto them. Looking for painful spots and breathing and relaxing. So if it's not painful, you can move it to another spot. So then then you're looking to press kind of on the tight spots and the painful spots.
Mm. Yeah, I want everybody who's listening to know that we will have the replay of this. If you aren't already on the email list, pop your name and your email, and we'll send you the recording of this, because I know I need to listen to this again as I'm pressing all these points. And also, Sharon, just give me a second, because I want to make just a couple of few short announcements here with everybody. And then I would love to have you come on and kind of close us out and tell us more about these tools and where we can get these tools. But before we do that, I'm going to pop Tell's GoFundMe. TJ, pop that back in there so everybody can please send either prayers or have a read, send $5, $50, $10, whatever, to help Tell, who usually produces these shows with TJ. And also, I want to let you all know next week we have really great guests coming on. Dawn Barnett is going to be on with her daughter, Myofascial Barnett, and they're both bee stewards. The show is going to be about bees, how they are responsible for planetary and humanitarian healing. And we'll be looking at all the medicinal properties of not just raising bees, but eating different bee products, how they affect our physiology. And one of the interesting things we'll be touching upon is using bee sting therapy for pain, releasing pain, arthritic pain in particular. So I hope you'll all tune in for that show. And if you, you'll get our daily dose of positivity and updates for that. And so, yeah, really, I don't think TJ or Shane, I don't think I have any. Oh, yeah. The other link I wanted to pop in, this is really appropriate for this conversation. One of the other amazing people that I follow, his name's Tom O'Brien. He's the gluten guy, the anti-gluten guy. And he is doing a summit. We're going to put the link in, and it's called Tame the Inflammation. A lot of this pain, that trigger pain that we're talking about, can happen with accidents, but it also happens from the toxic foods that we eat that store these toxins in our bodies. And it's a really good summit. Day one just happened today, but you can still listen to the 24-hour replay. And he's also got an inflammation diet recipe book that you can download for free. So we'll pop that link in there. And again, download the chat, and don't forget to put your email in here. And I'm just reading a couple of notes. People are really excited about this book, Sharon. And when her book comes out, we'll definitely have it in the chat. We'll probably invite you back on, Sharon, if
Sure.
you'll have us in a few months, and we'll do some other body
Good.
parts. Yeah, someone made a note here. Mary Jo is making a note. She says, Donna, one of the things that I have loved about Sharon for the almost 30 years I have known her, as she focuses on perpetuating factors, biomechanics,
So important.
and how we use and abuse our bodies, not as much of the emotional holding. We have plenty of people who talk about the emotional holding on this show. So if you want episodes on that, we'll put the link. TJ, go and pop the link to all of our speakers on our Donna Maltz page, to all the speakers. So, and you'll also be able to find the replay there in a few days, Sharon. So go ahead, Sharon, take it away and take us home here. We have a couple of minutes, and then we're going to go off live. And anybody who wants to stay on the live show and join, who was too shy to comment and wants a little more feedback from Sharon, will be on for another 15, 20 minutes after Sharon closes us out here. So don't go away. Thank you, Sharon. Go for it.
So here's the book, but here's the muscle. So the psoas muscle we were just treating with the ball.
Yes.
And then we treated the abdominals. What do you think? Can you see it? Okay. And then
now we can.
Here then we want to treat the glute muscle there. And then we treat all the muscles along the spine would be good. You know, we treated the little ones here in the lower part. And then here's pictures of how to treat it yourself. And then pictures of doing yoga. So doing stretches, the yoga stretches. So that's what I would do. That's what we're doing and this is what I would do. And anybody, I have videos. I have 2-hour videos on every one of these areas. They're in the book here, 2-hour videos. I made some of them an hour long. So if someone wants to call me, I could send them a protocol, or send me, if someone wants to text message me, they could text message me. What if you had pain in your little finger? What if you had pain in your back? I could send them a protocol for them to do. And if they like if they could do an hour-long video, I could send them a video.
Yeah. Well, good.
On how to fix that part of the body.
So what you're saying is we should put your number here in
yeah.
What you want to tell us, and then
yes,
TJ will
and
put that
they can text me.
All right. All right.
And then we could maybe talk. But even if they just texted me, then when I have time, no matter what part of the country, what time of the day, then I could work on it. I could send them a protocol for them to use to fix any part of the body that's bothering them. I've cordoned the body off into 60 areas, and I have 60 programs and 60 videos and 60 protocols.
Wow, that's amazing. So how do you feel about giving us your number on this? So the
number that they could call is 312.
People are going to listen. The people are going to be listening to this replay for years. So yes.
Okay.
So you're good with that. I just want to let you know that. So if you.
Well, this is my business line, and I've been using it for the last 20 years or more.
Okay.
It's 312.
Got it, TJ. 312.
709.
709.
2500.
2500. Well, you just heard what Sharon said. That's an incredible offer and opportunity, and I'm sure people can work with you virtually too. And when you call Sharon, she'll tell you about that. This has been super helpful. You actually hit on my two main areas, my trigger finger and lower back. I'm glad nobody wanted their ankles done or something, but that's okay. We can get that next time. And we also
we did soleus. We did the ankle muscle.
Oh yeah. We're going to put in the link to your website, and you have tools that mainly go to the Amazon shop, because Sharon was showing you a bunch of tools, and some of them, like this one, it doesn't even sound good, doesn't even work good. So the tools that Sharon has on her website, you can get them right off Amazon, most of them, right? And I would just go to her.
Yeah, I have a link. It's an Amazon store. Well, it's a store. If you go to my website, you'll
put
see.
It in.
If there's 3 little lines, and when you press on it, then it says store. You go to the store, and it's all Amazon links.
Cool. And then
to the tools.
Yeah, and then this one is a lifesaver for me, and the one you were using just looks like a newer edition of this one, right? So
let me see. I'm gonna come over there and look at it.
I got
Yes.
this from you like 10 years ago. So, well, listen, you guys.
At least 10 years ago.
Everybody who wants to stay on and visit with Sharon a little, please do. I want to just thank everybody who came onto the live show today and joined us on the Facebook groups and also in LinkedIn. The replay will be up in a few days. All the contact information, how to get a hold of Sharon and her generous offer are right there. And I also want to remind you all how amazing you all are and how much I love and appreciate you participating here on A Dose of Positivity. And may this show and all shows coming forward and all the replays behind bring you more joy, love, positivity, health, and wellness into your each and every day. So big love and aloha.
Aloha.
Aloha.